Okay, so the purpose of today's webinar is to go through how the Passaic County Homeless Service System is going to work moving forward. So we've talked about this a lot at CoC meetings, at subcommittee meetings, and we're finally at the implementation phase. We're going to just, see how it works and really update as we go. So the one thing I do want to say is one thing that we've talked about is starting on Thursday, December 1st, all referrals for shelter, for prevention programs, for really assistance in the homeless service, for emergency assistance, should be going through 211. So what I have on your screen right now, and I passed this out at CoC meetings, is really just a flow chart of how we're expecting the system to go. So 211 has a diversion screening that they'll do on anybody who calls. They will have your shelter eligibility criteria, and they will be able to do referrals directly. So if you have anybody who calls seeking shelter, you can refer them directly to 211, who will see what services are available for them, what they qualify for, and then we'll do the referral directly for them. So that's just something I wanted to make mention. In order to do that, I did send this out. If you got let me just show you what I sent out. So if you got this email in order to be on the webinar, then you got this form that I'm showing right now, the Passaic County Shelter Matrix. I do need this back from all shelters, transitional housing programs, and prevention programs ideally, because this is what 211 is going to use to make sure that they're providing shelters and prevention programs, the clients that actually make sense to be in your program. So I have gotten this back from some people, but if I haven't gotten it back from your agency, please, please, please try to send this to me by the end of day today. I'm trying to get it over to 211 so they have all the information once they start taking more phone calls and doing more referrals starting on Thursday. Okay, so I just want to make mention of that, but the main thing I'm going to talk about today, so once clients enter into the emergency shelter and transitional housing programs, what we have talked about doing is having that prioritization list, so that all permanent housing programs seeking or who have vacancies can go to one singular prioritization list. That would include anyone who is in a shelter, in transitional housing, and on the streets. And that if a person is appropriate based on their prioritization score, they would then ask for a referral for that client. So that's really this step right here is what I'm going to be talking about today. So this is mostly for those emergency shelters, transitional housing, and the PATH team workers who are going to be responsible for completing the prioritization tool and then placing people onto the housing prioritization list. Okay, so there is two ways for clients to be put onto the prioritization list. There's the HMIS. So if your program enters information into HMIS, I will be going through how to actually do the prioritization form in HMIS. But obviously there are programs that are not in the system, so there will be a separate way. So I'm first going to go over how to use the Excel version of the prioritization tool and how to get your clients onto the prioritization list if you're not in HMIS. And then I'll go into how to complete that same form in HMIS. So first thing I want to pull up is the prioritization tool. Okay, so this is what I put together. So in all of the subcommittee meetings for coordinated assessment, as well as at the full CoC meetings, we had come up with this tool that had a number of factors on it that came up with a score for each household. So this tool, this Excel form that you're looking at right now, is the actual housing prioritization tool that programs who are not in HMIS will be using. If you're in HMIS, you do not have to use the Excel form, but the questions are the same. So I'd still, pay attention as I go through because there are some nuances in how to complete certain answers in the Excel version and in HMIS. So if you're an agency that's not in HMIS, you're coming in. So this, you would only be doing this tool and the tool in HMIS on the clients who are actually in your emergency shelter, transitional housing programs, and the PATH team, those that are unsheltered, who need to get onto the housing prioritization list. If you have someone who just calls your agency or who walks in, but you are not actually sheltering them and they're in another shelter program, you do not need to do this tool on them. For HMIS programs, that's obviously a little bit more straightforward because you'll only have access to the tool for clients that you have in your system. But for those of you that are not in HMIS, You only need to complete this Excel tool on those clients that you're serving in your programs at that time. So the client name, we'll call this client John Appleseed. So as you can see, there are fields that are listed in green on this form. So only the fields in green will actually be able to write in. Otherwise, you won't have the ability to change any of the formulas. I've gone through so that everything is pretty much automatic as long as you answer the questions with the information that the client is giving you. I have created a Word document. In case it makes it easier for you guys, let me just show you that real quick. So this is the Word version of the prioritization tool. So in case you don't want to go through the Excel with the client sitting in front of you, if it's easier, you can just fill out this. It's pretty quick. It's only 15 questions. And a lot of this stuff you do already ask them in your intakes. So some of it you won't even have to re-ask them. It's just filling it out in case you want to do it on the paper tool before actually going into Excel to come up with their prioritization form. So I do have this available and I will be sending it out to you. The questions match exactly between the Word document and the Excel. So it's just a straight copy over if you're using this Word document first. Let me get back to, that Excel. Okay. So again, just a note, for those of you who do have to fill it out using the Excel form, nobody will be collecting these. This is strictly for you to keep as a record in your client's file, so you know that you created the form for them, and it's really just to come up with the score, which is what's submitted to me for the housing prioritization list, which I'll go through in a minute. So let's say your client's name is John Appleseed, and client ID, for those of you not in HMIS, you create the client ID yourself. So if you want to call this client 12345, whatever it is, that's fine. The key is you guys have to keep track of what the client ID is in relation to the actual client name. For the prioritization list, which I'll show you in a little bit, the only thing that's going to be on that list is the client ID. So you need to make sure that you keep track of what the client ID is for each client, so that if you actually get a permanent housing program that calls you for a referral and they say, hey, client 1234 seems appropriate for my program, you want to make sure that you can go back and say, okay, that's John Appleseed, let me get his referral packet together. I think someone has raised their hand. If you have a question, can you type it into the question box? You should have access to. If it's nothing, then I'll just move forward. Okay, completed by, that's just your staff name. That's really just to keep track of who is completing the prioritization tool. And then the date completed. Again, if you do have to update a prioritization tool, you want to make sure that you have these tools dated so that it's based on, sorry, I did get a question. So the question I got was, what about the clients who show up to the shelter? So if clients are showing up to your shelter, you should have them call 211 if they're seeking shelter. This way they can still go through that diversion screening or prevention screening with them to see if there are other options available for them. And then if they're still appropriate, they'll basically refer them either back to your program or to another shelter that actually has a bed available. So it's kind of cutting out the process where shelters have to call other shelters in order to place them, and it cuts out the process of you guys having to call other shelters to try to place them. Okay, so back to the prioritization tool, so date completed. Like I said, most of this stuff, as you go through, you probably already answered these questions when you filled out the intake with your clients. One thing to keep in mind is each prioritization tool only needs to be done on the head of household. So you don't need to do a prioritization tool for each individual family member. You're doing one per household. So whoever the head of household is the one that you would complete this questionnaire with. So the first question, what is the household's current housing situation? This is the program that you are using to serve them currently. So if they are in your emergency shelter program, you should be clicking emergency shelter. You can see that the score is automatically calculated. That's the formulas that I put in there. That's why everything besides these green cells are locked, because everything is pre-calculated. If you're serving them in a transitional housing program, again, that option's in there, or if, let's say, they're in the PATH program and they're still currently on the street, it'd be place not meant for habitation. But let's say this person is someone who is in my emergency shelter program. How long has the household been in that housing location? Again, that should be how long have they been in your current program. So if they just entered your program, it'd be 1 day to 1 month. If you're doing this on clients that have already been in your program, let's say someone has already been there for 3 months or 4 months, all of the options are in there. Did the household enter their current housing location from the street, emergency shelter, or safe haven? So that would be, where did they enter your program from? So let's say they entered the shelter from the street, so you would hit yes. If they entered from, like, you know, staying with friends and family, which I know a lot of shelter residents do, that would obviously be a no. If yes, how long was the household on the street, emergency shelter, or safe haven? So we're saying this client came in from the street, and let's say that they were there for around 6 months. You can see that there's auto calculation to figure out how long this client in total has been homeless. The deciding factor, in case anybody's curious as far as score, is 12 months. That's what we indicated on the tool. So if you were to answer 10 months on the streets beforehand and 4 months in your current program, then you can see it comes up with a total of 14 months, and then they get the score associated with it. Number of times the household has been on the street, an emergency shelter, or safe haven. Again, these are questions that most of you are probably asking, especially if you're in HMIS, which you'll see in the HMIS section when I go over it. So if they're in an emergency shelter program, which they are, this answer should always at least be 1 time, because they are currently homeless, and their current episode would be a homeless episode. So 1 time, it depends on, you know, how many times. 4 or more is what gives them the score. And then what is the total number of months the household has been on the streets, in emergency shelter, or safe haven in the past 3 years. So let's say we'll make this 7 months. This too helps us, I mean, this answer doesn't actually make sense. It would be, say, 12 months or more. These questions are really geared to figure out who would be considered chronically homeless or not. Obviously, we know that there's a lot of permanent housing opportunities that are available for clients that are chronically homeless. So that's why I have to get into kind of some more detailed questions about their length of time homeless, where were they coming from, things like that. Does any member of the household have a disability? So this can be a child, if it's a family member. The thing to keep in mind is that the household that you're asking about is the household that is currently in your program. So let's say you have a mother and a child in your program, and that's the household dynamic that would need permanent housing. That's the household that you should be answering these questions about. The mother, let's say, has another older child who lives out on their own, you wouldn't include their answers in these questions, because when it came time for permanent housing to qualify, that information wouldn't be included in the referral packet. So let's say they do have a disabling condition. If yes, specify the disabilities identified by the household. So let's say they identified a mental health issue. You don't have to answer all of these. There are yes or no's if you want to, but really, as long as you specify the one that they are identifying with, and that's fine. If they identified a disability, is this disability expected to be of long continued and indefinite duration and substantially impairs their ability to live independently? So I know we've talked about this question a lot at CoC meetings and in data subcommittee meetings. It is something that is required by HUD to say that this person has a disabling condition, which is a qualification for having permanent housing. If someone is coming to you and in their intake they're identifying a mental health issue, and it is something that is severe that they're willing to identify, I'm going to always say err on the side of yes to this question. You can see that it had an impact if you look down at question number 7, which is automatically calculated. If you say no to this question, they do not qualify as chronically homeless. They are not considered to have a disabling condition. That's just a question that HUD requires that we have to ask in order to get a clear sense of whether they qualify as chronically homeless or not. You do not have to have this documented when they're in your emergency shelter. That will fall on, you know, if they need a referral for permanent housing, that's the time that they would need that disability certification. But at this time, I would say if somebody is identifying a disabling condition, I would always err on the side of yes, and I will say that again when we go into HMIS, and like I said, that's something we've talked about at lots of meetings. So please keep that in mind. Chronically homeless, like I said, auto-calculates for you, so you don't have to worry about that. Is anyone in the household a veteran or served in the military? Again, there's more opportunities for veterans, specific veteran opportunities, and there's also a prioritization for them with the SSVF programs that are out, so we want to make sure that that's listed in there. That kind of opens up opportunities that not all homeless clients have access to. Please identify which, if any, of these sources of income the household has. So let's say they have SSDI. Again, there's a yes and no option for each of these, but you don't have to fill them out. Also, if you fill something out and you don't actually have an answer to it, so let's say you put yes, instead of just saying no to get rid of the score, which you could do, you can also just hit backspace and it will clear the answer completely. So that's a yes. What is the size of the household? So let's make this just an individual. So you can see then when I put one person, this question changed. So before, I think it was just listed as false. And then when I said this is a one-person household, it says, is the household's income over $990 per month? And then it's a yes or it's a no. That will change depending on the household size. So if you have a mother and 2 children, so you put 3 people, and then is the household's income over $1,680 per month? The amounts that we put in here, I think, were based on the official poverty levels put out by HUD. So that can be updated, but that's what we put in there for now. We know that that's not necessarily an amount that they can live off of, but that was just an amount that we felt comfortable putting a certain prioritization based on. Okay, when was the last time someone in the household held a job? Longer than 5 years ago, 2 to 4, 1 year ago. Again, it's just a simple answering the questions. These are really the questions that you most likely are not already asking on your intake forms. So I would say just take a look through this prioritization tool and look at the questions you're already asking if you're outside of HMIS, and just make sure that in your intakes you start to ask these questions to make sure that when you go to fill out this prioritization tool, you do already have the answers to these questions. What was the longest length of time a member of the household held a job in the last 5 years? So we said the last time they held a job was longer than 5 years ago, so then you would do less than 3 months. How many times has any member of the household been arrested or incarcerated? Let's say 1 time. How many times has any member of the household been to the emergency room? Let's say 1 time. And then how many times has any member of the household been to a psychiatric hospital or mental health facility? Again, let's say 1 time. This client has a lot going on. And then you can see the total household prioritization score has already been calculated for you. So as long as you answer all of the questions, the prioritization score will automatically calculate at the bottom. You don't have to worry about adding anything together, doing any calculations on your own. I've tried to set this up so it's as straightforward as possible for staff and when you're kind of going through with clients to try to make it as easy as possible. So once you have this completed for your client, again, I suggest keeping a copy in your records for your clients. You can, save a bunch of Excels if you want, or you can print it and save it into the client file. However you guys keep your records is fine, because I will not need a copy of the tool itself. What I will need is, let me show you, and this I've passed out a couple times at CoC meetings. So this is the housing prioritization list. So for programs that are not in HMIS, this is what I'm going to need a copy of. So pretty much you would do is once you've completed the prioritization tool on everyone, so client ID, that was the 1, 2, 3, 4, 5. Again, that's whatever you put it in there as. The household type would be individual. Number of household members is just 1. Head of household's current age, again, you'd have to have that through the intake, but let's say this client is 32. We'll say he's male. Now, chronic homeless status, you know that that was already populated using that housing prioritization tool. So you could always just go back and see, okay, yes, this client did meet. I highly suggest that you use this tool in order to determine whether someone comes up as chronically homeless or not, because it will help permanent housing programs to determine whether they actually will qualify based on time frame and disability. There's more steps that go into that, but at least you guys won't have to know the definition of chronically homeless in order to determine if someone is chronically homeless or not for the prioritization list. And let's just say, so 45 is that prioritization score, which we'll need to know as well. So let's go back to this tool. So this was a yes. Head of household is disabled is yes. Other household member disabled, so let's say you have a family and instead of the head of household being disabled, it's another household member, let's say it's a child. Obviously you would put yes here or no. Veteran, I think we did say that he was a veteran. So that's a yes. Prioritization score was a 45. Current location, so this is the program that you're serving them in right now. Again, so that would be an emergency shelter. Length of time in current location, we said that they had been there 91 days, I think is what we said. And then agency contact for referral, we'll just call this, I'll say that this is my shelter, so Caitlin, emergency shelter. So this is what I'll need filled out for all of the households that you have in your current program. So you would just go through, you know, if you've got another 1, 2, 3, 4, 6 instead, and let's say it's a family. There's 3 members, and household 35, female. Let's say they are chronically homeless. The head of household is disabled. Let's say there's other members of the household that are disabled as well. They're not a veteran, but let's say that their prioritization score ends up coming in as a 47, emergency shelter, and then let's say that they have been there for 100 days. Emergency shelter. What would happen then is when I got this list is I would do a sort, and then this household would end up being above this household as far as the prioritization. Their prioritization score is longer. They've been in their emergency shelter longer. So this is the list that I'll need completed, like I said, for anyone who does not have a current, is not in HMIS. This is the list that I will need pretty much updated based on your current roster. So the first time you do it, it will take a little longer, but otherwise it's really just maintaining it. I'm asking that this gets sent to me ideally weekly. You know, if you don't have the updates done, you can send it the next week, but I'm hoping to continuously update the overall prioritization list on a weekly basis. So what I'm going to do is once I receive this and once I pull the report from HMIS, this prioritization list will actually be for the full CoC. So you'll see, you know, Caitlin's Emergency Shelter on here, you'll see EVA's, you'll see Passaic County Women's Center, you'll see NJCDC Transitional, you'll see any emergency shelter, transitional, or like I said, the PATH program if someone is currently unsheltered on here. And that'll be the agency that you would contact for that referral. Are there any questions on this? Like I said, if you want to put it into the question box, let me see if I got anything. I don't as of right now. So this prioritization list and the Excel tool I will be sending out after the webinar. I did get a question if this is going to be in HMIS. So yes, for those of you who have HMIS, I'm going to show you as soon as I'm done with this how to enter it into HMIS instead of using the Excel form and the manual prioritization list. So as far as when we're starting, I would say as soon as possible. I'd say officially, I guess, starting in HMIS, it will be available starting Thursday, but I will send out this Excel version and the prioritization list to anybody who does not have the HMIS program. I can send it out this afternoon to the agencies who are actually on this webinar, so you can get started. As far as your first full prioritization list, you can send it to me pretty much as soon as you have it, and then I'll just continuously add it from there. I know, like I said, it's probably going to take a little while to go through, you know, your current shelter and transitional housing roster to actually get them to complete all this. But some of it, like I said, I think you probably will already have in your client files. It just might be getting a little bit more information. So that is all I have for those programs who are not in HMIS. So if you do not have any other questions, and you're not in HMIS, you can leave the webinar if you'd like, or you can stay on, but really I'm just going to move forward with showing HMIS programs how to do this same thing in HMIS. And obviously, if you have questions as you're going to do it, you can feel free to call me, reach out to me, email me. I know that this is a new process, so it's definitely going to be a learn as we go, so I will be available. I've tried to test every possible scoring option to make sure that all of my formulas and things are accurate. And I've tested it against HMIS to make sure that the scores come out the same. So hopefully none of that will come up as an issue. So, okay, moving on to HMIS. Oh, sorry. Let me just log in. Okay. So this is what it looks like when you log into HMIS for those of you obviously that have programs. The step of filling out the prioritization tool obviously will happen after someone is already in your program. So you will still go through the same process that you do to do the intake, to complete, their face sheet, to do their initial intake and admission into your program. All of that would still be the same. The only thing that I will say, moving forward, so now the 211 is going to be doing the initial diversion screening and actual referral to HMIS. I know one of the things that came up as an issue at the last CoC meeting was questions of, okay, well, a client comes in and says, oh yeah, I already talked to 211 and this is where they told me to call. But you didn't actually hear anything from 211. First, you should ask them if they actually called today. But the other thing you can do is do a consumer lookup. So I know Jerry, when he does trainings, and I think at different data meetings, we've talked about always doing a consumer lookup when a client comes in to see if they're already in the system. It saves you data entry time. But the other thing that it will help you do now is to see if that client actually called 211. So in order to do a consumer lookup, you just come up here to the search box, type in the name. So I do have John Appleseed. I clearly like this name in there already. And then you do search. So you can see that John Appleseed was actually entered into the NJ211 Passaic Coordinated Entry Program. They were entered in on the 23rd. So if you see a date here that they were in the program and were discharged, that means that they made a referral to an emergency shelter program. Now, like I said, if it was to your program, you should have heard from them because they are supposed to be reaching out to the shelter to make sure there is a bed for this client. But in case they say that they called and this is where they were referred to, if this is today's date, since they're entering in real time, you will be able to do the consumer lookup. And this status right here of having a from and to date, that means that they did a referral to the emergency shelter. If you do the consumer lookup and like this John Appleseed down here, again, it will say NJ211 Passaic Coordinated Entry Program, but it says since and there's a question mark. That means that they actually diverted them from the system. So that means that they determined that they weren't eligible for the emergency shelter assistance, that they probably needed, either prevention funds or they felt that they could help them, reunite with a family member. So this means still that they have talked to the program, but that they were not accepted as a referral to an emergency shelter. Now, there are possibilities that some people may have been referred and then were diverted, but if you see this in here, it means that their most recent interaction with 211, that they were diverted from the system. So just some things to keep in mind. Make sure that your staff are moving forward, always doing the consumer lookups. It also helps because, like I said, if you're going to enter this person into the system, when you do your intake admission and you do a lookup there, they'll come up as being able to enter in from 211. Because 211 is going to go through, and for these clients that they are referring that have a status of this, they will be filling out the complete intake in HMIS for you guys already, so that all that information is already collected, so you don't have to ask those clients the same information. So if you go to home, I don't know if I have the ability under this program that I'm in. But let's say, let me see if I have the ability to do it. No, I don't. But if you do the consumer lookup and you're going to add that client into your program, you will have the ability to add them in right based off of the information that 211 has put in there. So make sure everybody's using that consumer lookup. It's a great resource. So let's say you've already entered the client into your program, they've been in your shelter, or you're doing this, you're trying to fill out the prioritization tool for consumers who are already in there. The prioritization tool is going to be housed under this services button. So all you have to do in order to get access to it is you hit services. You make sure that you're on, let's say, your emergency shelter. So right now we're under the training emergency shelter program, and it will come up right here. So you see Passaic CoC prioritization tool. That's all you have to do to get to it. You just click that tool. You make sure you're under the right client. So let's fill it out for test rat. The date range doesn't matter because they're already in your program. You'll only be doing this obviously for consumers who are currently in your program. So you hit the, and again, you're only doing it for head of households, just like I told the client, the programs who are not in HMIS. So you go to whoever the head of household is, hit continue, and then you'll see this, it says create new Passaic CoC prioritization tool for test rat. That's all you have to do in order to actually get to the tool. So you click that, and then this is the same tool that I just went over in Excel. It's the same tool here. So you scroll to the bottom, you hit update, and then you can go through date of assessment, is today's date, what is the household's current housing location. So again, that's your program type that you're serving them in. So let's say emergency shelter. This person, there is some information in HMIS because you guys would have already gone through and done the intake. So I did, to try to ease some of the burden of filling out this form, I do have some fields pre-populating based on information in the system already. So how long has the household been in their current location? So 212 days is how long. So then you would just go through. Obviously, it's 91 to 330 days. So it's just a straight basing it off of 2A. I did the same thing for household residents prior to program entry. So this is based on what you put in that initial intake for the client. So they came from an emergency shelter. So based on the answer to 3A, did the household enter their location from a place on previous human habitation, emergency shelter, or safe haven? So that's obviously a yes. This is the only place where I had to add in some questions that the staff will have to enter in themselves. Unfortunately, with the logic in HMIS, I wasn't able to have everything kind of be auto-calculated or just filled in from what you already identified, especially too because some of the questions on this prioritization tool were asking about the whole household, whereas when you're entering it into HMIS, the tool itself, you're obviously only answering it about that current client. So I wasn't able to right now pull in what was filled out on the face sheet for the full household. So if yes to 3B, how long was the household on that street, an emergency shelter or safe haven? So we said that they came from an emergency shelter. So let's say that they were there for, I don't know, 10 months. So then if yes to 3B again, what is the total time the client has been homeless? So it should be a combination of 2B and 3C. So 2B, we've said they've already been in your program for 212 days. Okay, so that's around 8 months or so. So what you would do is you'd say, okay, so that's around 8 months. And this, let's say you can round up to 10 months. This is the only time I will tell you to round. I know it's not a perfect science. It's the way I had to do it on the Excel form as well. But we're really just trying to get a general sense of how long the person has been homeless. So if this day range falls in between, so it's 212 days, so it falls in between 211 and 8 months, you can round that up to 8 months. And then the answer to this question is 271 days and 10 months, so you can round that up. So 10 plus 8 is 18 months. So obviously the answer to this question is more than 12 months. I know that's not perfect. I know it's not incredibly clean, but unfortunately that's the way I had to set it up in order to try to calculate how long the client has been homeless before they came into your program and while they've been in your program. Hopefully there's no questions on that. Again, it's really just trying to figure out, okay, approximately how many months is this and approximately how many months were they in one of these locations, the street, emergency shelter, or safe haven, and add them two together. Now, if they said that they didn't, let's say instead of household residence prior to program entry being emergency shelter, let's say that it was staying with friends and family, this would be a no, and then you wouldn't even answer these two questions. So, because that time wouldn't count. It would only be based on how long they've been in your current program. Okay, but let's say it's yes, and again, let's say it's 10 months, so then it's more than 12 months. Number of times the household has been on the street in an emergency shelter or safe haven in the past 3 years, including the current episode. So it's listed as one time. Again, it's based on 4A. Please select the number of times the household has been homeless in the past 3 years. So it's just a direct answer from here, one time, one time. Just to give you guys some background on why it has to be that way. Unfortunately, right now, there's no way for me to put a score associated with things that are auto-populated. So I do have to have you guys answer that question, but at least I tried to make it as simple as possible of just basing it on answers that you've already filled out. Does any member of the household have a disability? Again, that's any household member, just like I said on the other form, that you're serving in the program. So let's say this is yes. And then if yes to 5A, is this disability expected to be of long continued? Same question as we talked about before. So let's say yes. So let's say they identify alcohol abuse and a mental health issue. This household's chronic homeless status is based on the information that was entered about the head of household. So based on 6A, please check whether the household is considered chronically homeless. If you think that this status is wrong, again, this is directly related on how you completed the intake. This is something that we've talked about at data subcommittee meetings at the CoC, is making sure that when you're filling out the intake for your clients, you're answering it as accurately as possible. Especially when it comes to this question of, is this disability expected to be of long continued and indefinite duration? This is something that I've seen people say no to. I think all emergency shelter transitional programs, you guys should be erring on the side of yes. If it is a disability that the household is coming and identifying a mental health issue, or that they do have some sort of disabling condition, and let that burden of documentation fall on permanent housing program when they actually have to qualify them. I would much rather permanent housing programs get a referral from someone and they not qualify because they couldn't get that signed off letter than for them to never even offer that spot to that client just because in HMIS it wasn't listed that they were chronically homeless based on their disability. So that's something I will continue probably to preach about. So if this seems off, I would say check your intake before you answer this question. So this is obviously a no because it's directly based on whether that household is considered chronically homeless. Is anyone in the household a veteran? Again, while you ask veteran status for individuals, that's a nice, easy thing, but I wanted to leave this open as a question caseworkers or whoever's entering into HMIS had to answer just because we are asking if anybody in the household is a veteran. So let's say yes. Let's say they have SSDI. How many people are currently in the household? Let's say one person. So similar to the Excel version when I went into it, I do have each household size, and then is the household's income over $990? Or is the household's income over $1,335? So it's the same numbers that were listed on the Excel. You just want to make sure, okay, so I said one person, so is the household's income over $990? This is the only way I could do it. I couldn't have it, only come up with the question based on the answer to number 9, unfortunately. So let's say no, he doesn't make that much. When was the last time someone in the household held a job? 5 years ago, less than 3 months. So again, these are all the same questions. So these are the ones, most of this other information you would have already asked about in the intake, which is why I had some of it pulled in. These questions at the bottom are the ones that you don't ask during your normal intake. So you won't be able to fill it out just based on information you already got from the client. So I would say make sure just to start asking this information during your intakes, and so you already have it. You guys can use that Word document as well if you want to. It's really up to you guys if you want to really add an additional form or just add additional questions to your current intake. Whatever is easier is fine. How many times? Let's say they've been arrested one time. They've been to the emergency room one time, and again, they've been to a psychiatric hospital. So right now, this housing prioritization score is no, but when you hit save and you scroll down, now they have a housing prioritization score of 36. The main thing that's obviously throwing it off is their chronic homeless status, the number of times they've been on the streets, which is what's different from that client that we did on the Excel form. So this is it. This is all you have to do. And then once you do this in HMIS, I don't need anything else done. You don't have to fill out that other Excel form that lists all your clients. So let me just remind you what form I'm talking about. I don't need this form filled out for your agency. As long as you are in HMIS and you are filling out those prioritization tools in HMIS for your head of households, again, only for head of households, I do not need anything else from you. I don't need your list. I don't need you to email me anything. Your clients will automatically be pulled into this prioritization list when I run a report for all heads of households in emergency shelters and that have the prioritization score. I will, when we first start this, obviously be running reports to see, okay, how many clients actually have prioritization scores, how many of them have stuff done. I know, like I said, with the other form, it probably will take some time for people to get everything in there, since you will have to do it on everybody. But pretty much, unless something changes about the household, let's say you find out later on that somebody is a veteran. Oh, sorry, I'm just going to go back to this. Unless you find out later on that somebody is a veteran or they change their level of income or something happens when they're in your program, you do not have to update their prioritization score. You don't have to. This is really just a one-time to get your household on that prioritization list. So otherwise, like I said, that's it. Once you're done with this, you can go back to the services menu, you can go back to home, you can go back to wherever, and it will already be in there. If you are going to update for a client, so let's say I found out that John Appleseed, or no, I just did that on Test Rat. So let's say I found out that Test Rat, I think I put him as a veteran, but let's say I originally said he wasn't a veteran, and I just found out that he was. All I have to do, as long as he's still in my program, go to the CoC Prioritization Tool menu, go back to Test Rat. You can see that this one's already done. So you can do one of two things. You can update it. So where is veteran? Okay, so I did already. So let's say I found out he wasn't actually a veteran. I can change that to no, and then hit save, and then you'll see that his score did change. So you can either update them, or if you've had a major change, if you want new information to be added in, you can always do an updated assessment. All you would do is go to Services, click the Prioritization Tool, Test Rat, Continue, and then you can create a new CoC Prioritization Tool. I will always use the most recent tool, though. So make sure that if you go in and create a second assessment for this person, that it has the most updated information in it, because that's the one that I will be using if there are multiples for a head of household. Again, please only do this for your heads of households. You don't have to do it for all the children. I think that's really it. This won't impact anything else. It won't impact your annual updates that need to be done. This is just where the prioritization tool will be held. I had to do it under the services section in order to bring information in from your face sheets. So you just have to make sure that your staff know that after they intake someone that they do have to go, again, to this services section right here. Even if your agency doesn't normally enter service information in about clients, you will still have access to this tool. And like I said, it will say this exact thing, Passaic CoC Prioritization Tool, just like it does here. Now you'll see, so let's say you're a program and you have both an emergency shelter and you have a permanent housing program. When you go to that permanent supportive housing program, you won't have that ability anymore. I will only open this up to agencies who have listened to the webinar and those who are in emergency shelter, transitional, or like I said, the PATH outreach team. So permanent housing programs won't be entering their clients onto this. They'll only be taking clients off of the list, which I will have a separate webinar about later. But if I go back to that training emergency shelter, it will pop up just like that. Are there any questions about completing this in HMIS? Let me see. Are we doing the tool for existing clients, or is there information rolling over automatically? So anybody who is in your program currently, that's who needs to have the prioritization tool completed for. So if you've already discharged them, we obviously don't need it done on, and if they're in your program and then a month from now they're discharged, that's all information I can get automatically just from running the report. But anybody who is currently in your program, currently on your roster, that's who you should be doing this for. So like I said, I will make this ability, this prioritization tool, accessible. I guess really I can do it as soon as I end this webinar. For those of you who have attended the webinar, I will, like I said, I did record this so I can send it out to your agency. So if you have other staff who need to listen to this or who need to figure out how to do it, you can either train them yourselves or you can have them watch the webinar. But it should be done, like I said, on any existing clients you currently have, because those are the clients that we want on the prioritization list. So that, let's say if next week, well, it probably won't be that quick, but let's say in 2 weeks or so, a permanent housing voucher opens up in one of the programs, you want to make sure that it's the clients that are currently in your program who are literally homeless who are on that list, so that they have the ability to possibly get that voucher, depending on their prioritization and their length of time and things like that. Like I said, I will have a totally separate webinar call about the prioritization list and how clients, are prioritized on it and how you can check. So all emergency shelters, transitional housing, the PATH team, as well as permanent housing programs will have access to that prioritization list. And that will just allow you to look up your client. You can see where they are on the list if you want to, since you'll know their client ID. And then that'll also, too, if there are notes about a specific client, so let me just go back. So let's say you have a client, and one of the issues is, so this will be automatically filled out, let's say for your shelter, and one of your clients, this family, let's say they are not a U.S. citizen. That might be something that you want to make a note about, because that just might make it a little bit difficult for some programs to accept them depending on their eligibility requirements. So all of these fields right here will be locked in this overall prioritization list. This will not go out in an email. It will actually be a locked Google Doc. So everybody will have a link that they can continuously access it, so that I can keep updating it without having to resend it out in an email to everyone. So the only thing that will be available for edit, kind of similar to that Excel assessment tool, will be this notes column. So like I said, let's say this household is not a U.S. citizen. Or instead, well, that'll be for another day, but for your emergency shelter programs, this is what you'd want to put in, things like that. Or did we say this person was a veteran? Okay, this person's a veteran. Let's say, but you already know, even though that they're a veteran, they're not eligible for VA services. Let's say that's something that you found out from working with the client. Those types of things that you might want to put in there. You don't want to put in if they have like a specific, criminal history or anything like that. We don't want to make this a way to kind of air clients' dirty laundry by any means. But if it's something that might have an impact on the program that they go into, so the VA is not going to take them, so the SSCF program might not be able to help them, or they might take them anyway and just double check their eligibility. But at least it's something that you've already tried to go through with them. The same with not a U.S. citizen. So those are really the types of things we're looking for as far as the notes. But again, I will have a separate webinar about the prioritization list and how to actually use it and what it looks like once everybody starts entering the prioritization or completing the prioritization tools in HMIS and through the Excel. So I don't think I have any other questions. I will leave this up for another minute in case anybody does have any other questions, but otherwise, thank you guys for attending and for staying on the line and staying attentive. I can actually see who's been clicking away and not, and it's nice to see that most people have been following along with me, so thank you. Like I said, if your staff have questions or if you have questions when anybody's going through this, please feel free to reach out to me, email me, call me. Like I said, I know it's going to be kind of a learning curve for everybody, but I can run reports to make sure your clients are being included, that it's coming up, that assessments have been done with them. So feel free to reach out to me, and I will do another webinar based on the prioritization list. So, all right, thanks everybody, and have a good rest of the day.